to talk about the effect of helmet wearing. And we're going to be talking about it in terms of the context as if soldiers or veterans, but really this is going to be anybody who, for protective reasons, has to wear a helmet and now is suffering or experiencing either neck pain, shoulder pain, or headaches. Hi, my name is Dr. Jeffrey Hanna, and I am one of the resident chiropractors at Blair Chiropractic in Spokane, Washington. And in this particular video, I want to ever so briefly mention the impact of wearing helmets. Now, of course, we have to wear these at different periods of time, whether it is on a motorbike, whether we are construction workers, and or, of course, if we are in the military or have been in the military for obvious reasons. Now, the kicker about that is that the nature of a helmet is that it is this additional compressive force that goes down on the top of your head. Sometimes it's only going to be a pound or two. Other times it can be upwards of about 5-6 pounds. And a normal human head is going to weigh somewhere around 8 to 10 pounds. So what are we saying here? We're saying that depending on what kind of helmet you may need to wear for occupational or recreational reasons, it could actually be anywhere between 50 up to 100 times as heavy as your actual head. So if I was to turn my head over, if you would, to the side like this, you'd see, and you can imagine that if we have a compressive force like this, it means that the normal spring that should be present in our neck is now subject to twice the load. And even though, yes, our neck is designed to be able to support some additional stresses and strains, we can only accommodate for so much before something eventually starts to give way. And we also know that when you've got this kind of compression like this, it's going to not only irritate discs, but every inch that your head starts to go forwards from its normal neutral center of gravity, what that's going to effectively do is double the weight of your head, let alone if you've actually got this compressive force on the top of it, let alone. And this is actually the really important one if and when you've ever had an impact injury, especially when wearing a helmet. Now, what do I mean by an impact injury? By an impact injury, I am referring to running, jumping, landing, falling, where there is a jar force like this. Ask anybody if they even have a headache, neck pain, or shoulder pain right now. Is if you do a sudden jolt, so jump up and jump down, you'll feel all of that extra pressure agitate and irritate you. Not exactly the same, but it's the exact same ligament structures and neurology. It's why if and when you have a hangover or a migraine, your head just wants to feel like it's going to blow up. Impact injuries, that's what's actually going to be producing most of the damage. Now remember what we had already said. We'd said that the weight of a helmet can increase the load on your joints 50 to 100%. When you add impact into the equation, it can effectively quadruple the amount of force that you're experiencing, let alone if you've got poor posture and poor muscle tone to begin with and your head is already sticking forward. Then it starts to have an exponential effect. So what we're saying here first and foremost is for any single person, whether you are actively doing something where you wear a helmet or when you are in the past having done something where you wear a helmet, it's important to make sure that the health of your neck is the way that it should be. Otherwise, that compression may still be going on. Now, what do we mean by that? Oftentimes, when people, especially if they've been in the military, they come back and then they start to develop certain health issues. And they're told, okay, what you need to do is you need to do your physical therapy, and you need to do posture exercises, and you need to do stretching exercises, and you need to do strengthening exercises. And all of these things are wonderful. But there's still a good chunk of people who experience these kinds of problems. So then what do? Well, they're either going to go to their doctor and they're going to be given some medication. B, they're going to have some scans and they're told, oh, you've got a disc issue and you've got some arthritis. You may just have to learn to live with it. And or if it ever gets severe enough, then it may come to the point where you're saying, okay, well, we may actually recommend surgery for you. Unfortunately, even these strategies don't work for a large percent of the population. So the question is, well, why is that? I mean, if we have disc damage and restrictions and neck pain and headaches and shoulder pain and all these things, why shouldn't something like a surgery work? And the reason that I'd like to propose is because that's not always where the problem is coming from. So remember that we talked about how your neck is meant to be a bit of a shock absorber? Well, 50% of your total head and neck movement comes from the level of C3 down through C7. So that is the lower part of your neck. The upper part of your neck, which spans the width of 2 fingers, your C1 and your C2. That's the other 50% right there. And that complex actually doesn't have any discs associated with it whatsoever. And yet this is the area that has to directly support the weight of your head. So as opposed to where we may have disc damage, what we can have instead at this location is where the joint complex, which is normally designed to be able to move like this, can become locked and trapped, stretching some of the ligaments, not to the point where it's unstable or to where your head is literally about to fall off your shoulders, but where there is additional stress, pressure, and strain compressing you right up at the top, which is causing these vertebrae to misalign, to move abnormally, and causing your body to have to then try to compensate in other ways, which contributes then and leads to neck pain, shoulder pain, and also headaches. In other words, these symptoms may be nothing more than the effect. They are not the primary cause. And that's why the treatment focused at the lower neck unfortunately does not always work. Now, there can be other plausible explanations here as well, but this is a big one. This is a really, really big one that I want to make sure that the people who are watching this video understand. And that is that if and when you have had a neck injury, even if you thought it was a relatively benign kind of thing, it's important not just to be looking for the big stuff like the tumors, the fractures, the dislocations, the bleeding, all that sort of stuff, but it is essential to make sure that you're having the health of the upper part of your neck properly studied, properly visualized, properly diagnosed, because if that problem goes undiagnosed, which unfortunately is far too common these days, it means that we are setting people up, not just the individual, but also their friends, their families, our society as a whole, to have to then deal with the consequences of these neuromuscular issues that may not necessarily kill us, but certainly make our lives a lot more difficult, a lot more challenging than they need to be. And so, again, if we are in an occupation or recreationally where we're wearing a helmet or we have worn a helmet, very important, especially if you're already experiencing these symptoms, because your body's capacity to adapt to that stress, by the time you start feeling anything, you've already lost 50% of that capacity right then and there. So if you're experiencing that, make sure that you're not only having the health of your lower neck properly assessed, but that you are also having the upper part of your neck properly assessed. And if then you're able to get that kind of issue properly corrected, properly stabilized, then that is where all of those other activities that you're probably doing right now, again, the stretches, the rehab, the strengthening, and the relaxation, that's going to be when those actually have the opportunity to work the way that they are supposed to. We have to make sure that we are putting the horse before the cart. And one of the most important things when we're dealing with head, neck pain, shoulder pain, all that sort of stuff, and headaches, is making sure that our system is free, aligned, functioning, and clear to work the way that it's designed. Thank you for watching this video. I do hope you've enjoyed. If you did, please, number one, like and subscribe to the channel because it helps this video get found by other people who need this information. Number two is if you know somebody who would benefit from hearing this information, please do share this video with them. And then number three is if we've identified something in this video where this sounds like you, we'd have you reach out to us at our practice. We're at Clear Chiropractic with 2 locations in Spokane, one at South Hill for the south, and then the other at in Mead for the north. My name is Dr. Jeffrey Hanna. Hope you've enjoyed this one. Get well, live well, and stay well.